Hello learners! Miss Priyanka Kutte is going to teach you a chapter on Introduction to Health and Illness. Happy learning!
Dimensions of health. What are the dimensions are? The general meaning of dimension is it's an extent of measurement of any kind. It includes the length, the depth, the breadth and the height. So when you calculate these aspects into the health aspect, there are many dimensions acting as a measurements in order to measure the health. So those dimensions of health are physical, mental, social, spiritual, emotional, vocational, intellectual, and the final thing is environmental. So these are the 7 dimensions have been identified in order to measure the health. As I said, they are interrelated, they are independent, they are also interdependent in order to bring and maintain the nature of health and healthy lifestyle. Let's speak about the physical dimension. When I mention the physical dimension, it is measuring the health in physical terms. The basis for physical terms is biological pattern of a human body. We all know the human body is made up of cells, organs and the systems. So the physical dimension of health is measured by the optimal function of each and every organ and each and every cell in the body at the same time, the harmony of each and every organ with the other body organs or other systems in the body. So how do we say that? Let's take an example of a heart. When we say the heart must function normally or physically, how do you measure a physical dimension of a heart? We all know heart is made up of chambers and the valves and ducts. So when you take an example of the blood supply from the heart is the one which need to supply the blood to all other organs in the body. That is supplied by ascending aorta and descending aorta. Having said that, heart also need the support of the circulation or the blood to function normally. So when you see that the independence and the interdependence of each and every organ, along with that, each and every organ also must work normally. What is the term normal means? It is the normal parameters of each and every organ. Let's take an example of 5 senses we have. So we have eyes to see, we have nose to smell, we have tongue to taste, and along with the 2 other senses. So we all know how the 5 senses must work. When they are working properly, when the human being can see with his eyes, when the human being can smell with his nose, when the human being can taste with his tongue, that is towards the term that we use to say that is normal functioning. Along with that, we also have the vital organs in our body. And we also have the term as vital signs. Vital signs are the temperature, pulse, respiration and blood pressure. 5th newly added one is called as pain. So these vital signs also, we say them in normal ranges. How do we say that they are the normal ranges? This has been done with the many researches that are happened in the medical point of view. Example, the temperature of a human body must be 98.6 degree Fahrenheit. If not, the person will fall into a hypothermic if it is less than that. If it is more than that, the person will fall into a hyperthermic. Both are abnormal. When the person is maintaining all these normal values within the normal range, we are calling that person as a physically healthy person. At the same time, these normal ranges that I mentioned is for an adult. That same results are different when you calculate a person with an infant or an old age group. So these vital signs changes from an infant to a toddler to an adult and also to the older group of people. So according to age and according to the gender of a person, these vital signs or every body function changes, and that has their own importance to calculate the person as a physically healthy person. So let's see some of the signs. How can we notice the person is physically healthy? These signs helps us to notice the person is physically healthy or not. These are external features that we can notice on a person's body. There are also some of them internal things, that is the physiological pattern of a life. They are good complexion, clear skin, lustrous hair, bright eyes. Along with that, there are physiological ones having a sound sleep, eating a regular balanced diet and able to digest them, having a good appetite, and a well coordinated regular movement at the same time, having a regular bladder and bowel movement. These are the physical and physiological features helps us to notice the nature of a person's physical health. How do we notice the person, or what is the assessment tool that helps us in order to understand the physical health of a person? These are many techniques, Many tools or the combination of different techniques and tools in order to assess the physical health of a person. Those are self-assessment tools, physical examination scale, clinical examination scale, and there is a scale and also assessment tool in order to write down the risk factors of a person, and also the clinical pathology scale and the dietary assessment and the nutrition assessment of a person. The basic thing or basic idea of these tools and instruments are they are helping us to know the person with the signs not just the physically visible, at the same time they are internal ones. Example, the physical examination. Physical examination includes the demographic data of a person, the name, the gender, height, weight of a person, socio-economical status, as well as the chief complaints of a person, at the same time the present illness and the past illness, and also socio-economical factors. The socio-economical factors also plays a role in order to understand the physical health of a person, that we will see in the social dimension. As we are looking into this physical examination scale, let's take an example of height and a weight of a person. We will understand with the help of height and weight whether the person is ideally maintaining his own weight according to his height and age or not. So that tells us whether the patient is fat, obese, or lean and malnourished. Like this, these are the tools which are helpful for us in order to understand and evaluate the physical health of a person. So let's talk about the mental dimension or a psychological dimension. So how do you measure the mental health of the person according to the mental dimension? It is, in other words, it can be said like the mental health is an ability of a person respond to the different experiences in life with a sense of purpose and also with flexibility. I said three things. It is a response, not a reaction. It is a response of a person at the same time with a sense of flexibility and with a sense of purpose. So they should be able to identify why the thing is happening in their life, why there's a change in his life. At the same time, he has to adapt and adjust to that particular change that's happening in his life or her life. At the same time, there's a flexibility. It is being blend to the situation. It is adjusting and adopting the new change. At the same time, this is also defined in a way that it is a harmony and a balance between oneself and the others. It is between the individual and the surroundings, and it is also coexistence of self realities and the realities that are happening in the world. In other words, if you understand or if you observe the life of a human being, there are many changes that are involved, not only the biological way, even the psychological way. Let's take one example. When a person is completed his education and joining in a new job as a new experience, it is a completely different thing. He is completely away from his education, he is completely away from his friends and acquainted things. They're all new persons, but still even something happens in that particular job, even his officer or her boss says something or shouts on them, he need to understand that particular situation, why the thing has happened, and he need to adopt and change and learn from it. At the same time, when a patient comes to the hospital, we need to understand as a nurses the psychological and mental aspects of a human being, not just a patient but a human being, and able to give care to the people, understanding their own mental abilities, their own mental response and reactions toward the illness that is suffering by them in a person who is mentally healthy. So what do you mean by that? When you call him as mentally healthy, the first and foremost thing is he should identify what are his internal conflicts and at the same time violating them, making himself or herself free from those internal conflicts. What are these internal conflicts? There are struggles that are happening in the person's character, especially in his mind. So he must be able to understand what are his internal conflicts. The stress factors need to be identified at the same time, having good people in the community, talking to them and expressing them and making them free from those internal conflicts. Well adjusted. What does it mean by well adjustment? Wherever the situation may be or whatever they are involved into, they must be well adjusted to that particular environment. At the same time, they must be the people identify their own needs, their own problems, and also their own goals. So we don't need to go after our thoughts. We need to prioritize the needs at the same time, able to solve those needs. We need to solve those problems and fulfill the needs according to our intellectual capacity. And strongly, we should have the self esteem and the self control. Self control is an ability of a person. This is linked also with the spiritual aspect of the health. So, when we have the control, we always speak about the inner man. So, when we train that inner man, we have the self control, having or knowing the priority of our needs and controlling the external factors and also the controlling internal factors, knowing them purposefully and fulfilling them. At the same time, finally, the self esteem. Self esteem and the self actualization. have been identified as the needs of a human being. According to Maslow's hierarchy theory, they are at the peak: self-esteem and self-actualization. So when can a person reach that peak in the hierarchy of needs? When the person has his own goals at the same time, when he strives to achieve those goals, and when he fulfills those goals in his life, he's actually reaching the self-esteem and self-actualization and reaching the peak of hierarchy of needs. Right. Let's understand what are the tools and instruments in order to understand, or in order to know, evaluate the mental health of a person. We have different methods and we have different tools and instruments. Some are basic instruments and some are standardized instruments we use in order to understand the mental health of a person. The first thing is basic mental status examination that we all do. Being the nurses, we need to understand the mental status examination. It speaks about the basic demographic data of a person, at the same time his mood, his attire, his physical features, at the same time the mental ability of a person. Let's take one aspect in the mental health or mental status examination, that ability of a speech. When the person is speaking, by the way the person speaks, you will understand whether the person is mentally ill or mentally healthy. Let's take the pace of the speech. If the person is continuously speaking without giving any pause, without having any trouble in his speaking, by showing the anxious face in order to let the content out, that person is actually a maniac kind of patient. The person is who is mentally ill. Same thing with the depressive patient. When the people are very quiet and they're unable to talk anything, even if you involve them into a good conversation, they say yes and no. Other than that, they don't speak. Those kind of people are involved in quite depressive kind of people. So this is a mental status examination, helps us to know the person's mental ability or mental health. Along with that, we also have the standardized tools, which includes self-concept scale, anxiety scale, depression scale, the ability of problem solving scale, and also IQ scale in order to understand the intellectual capacity of a person. And finally, we also have the personality scale.